into First at 4. We are welcoming in Chris Elliott. He's the Vice President at Barber Behavioral Health. And we're launching this new segment called For Your Mental Health, just covering all those issues that we know we need to talk about, and sometimes it's a little bit difficult. But Chris, welcome into First at 4.
Yeah, thank you for having us. We're glad to be here.
Yeah, so what should we know about mental health?
It doesn't discriminate. All of us, young, old, male, female, we're all human, and we all experience different things that we need help with from time to time. So there's no shame in reaching out for help. So that's one thing we need to do more in our community is, promote this as something that it's okay to talk about. We're here to help, and there's various other providers out there as well at this time when everybody could use a little help. And
you're with the Barber
National Institute.
Barber National Institute,
yep.
And the Barber Behavioral Health. So talk about how those two work together.
Yep, so we're just a service line of our Barber National Institute. So I was doing some research for our segment today, and we started doing some early intervention services back in the 1970s as our first foray outside of our true, our largest area of group homes and day programs. But then in 1995, we actually did our first behavior services. So we've been doing this over close to 30 years now, and we've grown from doing some simple early intervention, so that's PT, OT, and speech services, to having a summer camp for kids on the autism spectrum. So we offer a variety of services throughout Erie County for children and adults, and we're here to help.
Yeah. What do you think when it comes to mental health? What is the biggest misconception out there when it comes to mental health?
Misconception would be that
during the pandemic, there was a significant.
We should not be afraid to talk about it. Like I said before, it's okay. We all struggle with things in our daily lives, and it's okay to ask for that support when you need it.
Are we seeing, do you think, more people struggling with their mental health, or are we just talking about it more?
I think it's both. I just read something the other day that even for kids, it's affecting them more and more. There was a study by the Pennsylvania school boards that 46% of kids are experiencing some sort of mental health issue. So I think it's a lot of things. It's out there in the news more, but it's also we've been isolated. People aren't commingling in the community as much anymore. So it's just all sorts of different factors.
And we hear so much social media and the point of, well, my life doesn't quite look like this person's life, and that comparison factor has to play a part, right?
Correct. Comparison is the kind of the root of all evil, right? If you're always comparing yourself to somebody else, you'll never be happy. So, your segment earlier was talking about self-love and self-care. One of the things that we'll be talking about on these segments is practicing that self-love and self-care and compassion. And that can look like a different thing, just going outside for a quick walk, to get some fresh air, or providing some grace for yourself as you struggle in things on your daily life.
All right, well, we're excited to kick off this segment here on First at 4 for your mental health. There's some information there about the Barber Behavioral Health Center, but of course all tied into the Barber National Institute, which we all know and love, and the website there where you can find a little bit more information. But Chris, thanks so much for being with us.
Thanks for having me. Glad to help
today. John, I think we're going to send it over to you for a look at some trending weather.